Hi, you guys. So I'm actually just messing around with YouTube Live because I've never done a live on YouTube before. And it's 6:41 Pacific Standard Time, and I just got home and was just messing around with my computer. I'm like, I want to see if I can go live and see what that's even like. So this could be a forum that I can use to interact with you guys and have you guys ask me questions. I don't know if the quality of this video is even going to be good or if the audio is going to be good, but I just wanted to be able to provide a forum for you guys to be able to ask me anything, especially being, like your own little personal dermatologist slash scientist slash formulator. I wanted to make myself accessible to you. So I do this on Instagram a lot. I usually do this on Fridays, especially since launching my skin line. I wanted to be live and just be able to interact with you guys in real time and have you guys ask me any questions in dermatology or about skincare products. And this is so fun. I'm already getting questions. So this is, it is blurry on my end too. So I'm using the webcam on my camera. So maybe I could figure out how to use a different camera. If you guys have any advice, I'm a complete novice to YouTube. Instagram's more my platform, but it's great to just have your feedback right now. Yeah, no, I think that's a great recommendation. So audio's okay, video's a bit blurry. And can I ask you a question? You can put your can you put your new eye cream on your eyelids? The eye serum, absolutely. You could put it on your upper and lower eyelids. No problem. And the hydrator, you can actually put pretty close to the eyes too. I wouldn't recommend vitamin C or retinol towards the the infraorbital or the periorbital area because the skin is very sensitive and I wouldn't get it there. But I think it's totally fine to put the hydrator and eye serum there too. So it's so fun to see everybody. I feel like this is my new YouTube family because my family on Instagram is pretty big, but I feel like this is a totally different platform with a different kind of family. And I think that it's really nice to meet you guys and to interact with you guys and engage with you. And you always have such insightful questions and comments. I don't know if you guys can see each other's questions, but you have a lot of great questions already. So I'm going to try to get to you, get to everybody. And I also think it's important to do Instagram lives YouTube lives because being live is in real time. And a lot of these, people who are on social media have to look things up and Google them and memorize them and then regurgitate information. But for someone to really be able to talk in real time and answer your questions on the fly, I think really shows, what they know and what their experience and expertise is. So it's not something I have to look up or whatever. I can just answer you guys on the fly, which I think is really fun too. And it's probably fun for you guys too. You can challenge me with questions. So, hi everyone. It's so great to see you guys. I love to see you and learn all the knowledge you have, and I appreciate you. Thank you so much for appreciating that knowledge and allowing me to share it because I love skincare and I'm passionate about skincare and dermatology, and I'm really happy to share information with those who are just as excited and passionate about dermatology as I am. So I finally found my crew of people who love skincare as much as I do. So somebody asked me, am I taking new clients? So yes, I am taking new clients. I have a little bit of a wait, but definitely I take new clients. I welcome anyone into my office and my practice. Usually people who come to see me have been following me for a little while, so their skin already looks amazing when I see them. And then to see them in person is a real treat and a delight. You guys are the reason why I do what I do, not only on social media, but in the clinic every day, seeing my patients and my beauties and doing, skincare treatments and consulting you guys with what products work best for you and your skin. So it's really fun. So somebody asked what percentage of retinol is my new product. So for those of you who don't know, I just launched my own skin line, MD Air, and it is AIR just stands for the signal transduction pathway that we're upregulating for anti-aging. So it's a very scientific term, and I had to put MD on it to differentiate it from other products. But I do have a retinol cream, and it's microencapsulated retinol, and it is a 1%. I'm thinking about maybe making it a lesser percent option, having a 0.5% and a 0.025, but the way it's encapsulated and the delivery mechanisms and spherules that it's encapsulated in to get it into the nucleus of the cells makes it not very irritating. So I feel like I may not have to go up on the percentage because 1% is pretty high, especially for people who aren't used to vitamin A derivatives or retinol. But I wanted to kind of start with that. And because of the way it is manufactured and formulated and elegantly engineered, it shouldn't have too much of irritation. But I kind of wanted to wait to see what the feedback was because most patients are liking it so far. But, we only launched a few weeks ago. So I may have options with a lower percentage, but for right now, we're doing 1% and it seems to be doing the job without causing too much irritation. So thank you guys for all the support and feedback. I love you. This is really fun to interact and chat with you guys. Okay, do you have before and afters with my eye cream? I have histological assays with trichome stains showing increased collagen and elastin synthesis. But as far as right now, we're waiting for patients to use it, patients being my friends and family members and patients who have used the products for at least 6 months to do assays and to do before and afters. But we do have some before and afters. But, I wanted to wait. It's always good to wait for 3 months and then 6 month mark to see the before and afters in clinical pictures, but not only pictures of the skin clinically, but under the microscope, what it's doing to the skin. So I'm a super science nerd and I love assays and tests and immunocytochemistry and immunologic stains to see what skincare products are actually doing under the skin, lasers too, or treatment. So I'm all about that. And we'll be able to provide that information for you once we get it. Absolutely. Okay. Somebody said, I love your morning skin routines and your evening skin routines. I post that every day, almost not every day, but a couple times a week on my Instagram stories. But I realized that my YouTube family wasn't getting those skincare routines. So I uploaded 2 of them that I did yesterday, but I can keep those coming if you guys like that, because I do switch up my my skincare regimen and the products that I use periodically. And so it's good to just kind of, keep you guys in the know of what I'm rotating through as far as different products. And this is a totally spontaneous live. If you guys like this, let me know and I can maybe make it a scheduled thing that I can do like every Sunday to be here for you and answer your questions and do a live. I do that on Instagram every Friday, but I was thinking Sunday may be a good day. We're all winding down from the weekend and hopefully, our kids and families aren't demanding too much of our time, so we could sit and chat and I can answer your dermatologic questions or skincare questions or whatever questions you may have. Okay, getting back to more of your questions. Oh, is it the same as Skin Better Science Retin-A? So for those of you who don't know, Skin Better Science is another really next level skincare line. And they have their Retin-A, which is called Alpha Ret, and it's a double conjugated retinoic acid that has a really potent effect with decreased sensitivity. Mine is very similar into the Skin Better Science technology in that it stays within the nucleus inside the cell, and it doesn't stay in the extracellular matrix where you can get a lot of recruitment of inflammatory cells and irritation and redness to give you that red, dry, peely effect. So it's pretty similar to the Alpha Ret in the fact that it's potent without much sensitivity. However, the engineering is different. My Retin-A is microencapsulated with a certain delivery mechanism and a stabilization mechanism in it. I'm working with a really amazing scientist who actually worked in pharma. He spins electron vectors and does all these crazy, amazing things with IP on this technology, but it's different than Skin Better Sciences, which is a double conjugated retinoic acid. It's conjugated to, I think, a lactic acid to help minimize irritation and to allow it to have the potency of almost a prescription strength tretinoin. And so technology is similar in that they stay inside the cell, which is where you want your vitamin A derivatives to stay, but it's formulated in a totally different manner. So, but they're both great. They're both amazing. And for those of you who haven't tried the Alpha Ret by Skin Better Science, it's a great retinol as well. Okay. So let me see. Somebody asked about Pixel for under eye crepiness. Pixel is okay. It's probably not one of my favorite treatments because the results aren't as substantial or long lasting as like a Fraxel or a CO2 or deep effects, scar effects. But it's a great treatment. People do like it. I don't know if they like it more than laser resurfacing, but people do have great results with Pixel for under eye crepiness. Remember that under eye skin needs stimulus to stimulate collagen and elastin and to increase the extracellular matrix proteins that give that skin that tight, that tight, smooth texture. Because as we gain wisdom and have birthdays, we lose about 10% of our collagen and elastin each decade. So that's why we get loose, laxed skin in that area. So it's really important to stimulate our skin's own regenerative processes to make that back, so that as we lose collagen and elastin, we're still building our stores. And basically that's the true meaning of anti-aging. Whether you're doing with an eye serum or a laser or an energy-based device, you got to keep this area chock full of collagen and elastin with a good elasticity over time. So it's easier to maintain what you have and be proactive about it than it is to let it go and then try to reverse it later, because more often than not, sometimes surgery is needed, which isn't the end of the world. It's just I'm more of a minimally invasive, non-surgical intervention type cosmetic dermatologist. So, okay, am I making a hyaluronic acid product? So I have a NMF hydrator. So the hydrator is packed full of anti-aging peptides. It does have hyaluronic acid in it. Hyaluronic acid is tricky though. It has to be a very low molecular weight hyaluronic acid, almost the building blocks of AHA, because those molecules are too big to soak through the skin. Another problem with a lot of hyaluronic acid formulations out there, and I know this just being a formulator and a scientist, and also for my derm residency and studying for boards, they test us on the bioavailability and the pharmacology of a lot of dermatologic topicals and products. Hyaluronic acid can have the opposite effect. It binds about 1,000-fold itself in water molecules. So the opposite is true. And you want the hyaluronic acid to push the water into the skin and not pull it out. And sometimes when hyaluronic acid formulations are not engineered correctly, it can pull water out of the skin. So I had to be very selective with the type of hyaluronic acid I used. And it's in the NMF hydrator. And it is a very low molecular weight building block of hyaluronic acid, so that it can get through the skin safely and effectively through the epidermis, into the papillary dermis, through the reticular dermis, and it wouldn't suck water out of the skin and have the opposite effect. So yes, I have an HA, and sorry that was such a long answer to your question. Okay, are there samples or trial sizes of your product? It's a lot, and some of us may want to test texture before committing. I totally understand that, and I get that. I just launched about 3 or 4 weeks ago, so we haven't really gotten around to trial sizes and things like that and getting samples. I do want to get those to you guys. So the products are along the same price point as Skin Better Science, Zeo, Elastin. These are high quality ingredients that we're using with a lot of assays and studies that we perform on them. And the scientist that I hand selected, who I heard give a lecture, who's amazing, young, highly innovative genius, he only uses, the active ingredients that are the purest and most high quality, high grade, in an amazing lab. And the containers and packaging that it comes in maintains the integrity of these products inside. So nitrogen lined, airtight chambers, things like that. So, I invested in the skincare line, and, I could have a lower price point, but it probably wouldn't work as well. It would be just like every other skin line out there that, that maybe kind of works, but not a slam dunk every time and not innovative in the technology and so forth. So I do want you guys to be able to sample it before committing, but we have to work on that still because we're still in the initial stages, and we're just right now trying to we sold out twice right away. So we're trying to get the balance of having, and I want the product fresh from the lab to your doorstep in the fastest amount of time possible. So it's a balance between having inventory enough and having it, having not selling out every, week. So it's a little bit of a balance. And I think once we get that rhythm going, then we'll be able to do things like samples. And then I also have to think of wholesale too. I'm getting a lot of questions about that. A lot of my dermatologists and plastic surgeon colleagues want to be able to sell the product in their offices. But right now I just want to keep it for my beauties, my patients, my followers, and, and ones that I hold close to my heart, like you guys, everybody on my YouTube family, my Instagram family, and my patients who I see in the office every day. I don't want to sell out and not have enough inventory available to everyone. So hopefully down the pipeline, we'll be able to have all these things. But right now we're still in the total infancy, early stages of everything. So, okay, so moving on. In your most recent skincare routine, you stated that you normally use tinted SPF. How do you protect against HEV light? I understood zinc offers little to no protection. So I'm glad you asked me that, because that's absolutely false. So HEV light, non-visible infrared light emitted from our devices, zinc and titanium dioxide are the only physical blockers that block against HEV light, and also iron oxide. So it's the iron oxides in like Color Science, Tizo, Elastin, Hydra Tint, Sun Better by Skin Better Science. These all have they have iron oxides that protect against environmental pollutants and HEV visible light. Zinc and titanium also block against the whole UV spectrum and do get the HEV light as well. They actually ask us this on our dermatology boards. And when you look at like chemical sunscreens, the reason why there's so many chemicals in the active ingredients list is because it like piecemeals different, like UVA1 to UVA2, UVB, and this many nanometers to this many nanometers against the Roy G. Biv electromagnetic spectrum. They're kind of like just pieces of coverage within the electromagnetic spectrum versus zinc and titanium dioxide give a full blanket over the entire thing. But if there is any paucity of coverage of the HEV light, that comes from the iron oxides in the tinted sunscreen. So the ones that I was talking about today are packed full of iron oxides, which help protect against HEV visible light from our devices, which is really important because that light, if you're like, even right now I'm on my laptop with the blue light shining on my face, well, hopefully I don't, I have sunscreen on, but that increases matrix metalloproteinases, which break down our collagen and elastin. So I don't expect everybody to wear sunscreen at night, but I do, because when I'm on my, laptop and my phone, sometimes it's breaking down that collagen. And then before bed, I try to like turn my screen brightness down and I try to minimize how much I'm exposed to that, because even, we have to worry about UV light, but also we have to worry about that light that is emitting from our devices, especially like in, younger beauties who are, premature aging, at risk. It just is really important to wear sunscreen to protect against not only UVA1, UVA2, UVB, but the HEV light as well. So iron oxides, to answer your question, that's how we get that protection. So it's so great to see all you guys and everybody joining. I wish I would have had a better quality. I literally was just doing like a test. I'm saying, I'm going to see what this YouTube live is all about. And I know that this video is grainy and I need to figure out, if you guys have any suggestions for me, maybe I should just use like a Nikon camera or some type of camera, but I'm sorry that it's so grainy, but at least we were able to communicate and I can see your questions here and respond to them in a timely manner. So let me see. So are you going to make a scrub like Zeo exfoliating polish? And you said you really liked it. So I do love the Zeo exfoliating polish. What I don't like about that is there's dye in it because it's blue. I mean, it looks pretty, but there's dye and fragrance in it. So I'm trying to make an exfoliating polish. We're working on that right now. That is clean, that is fragrance free, that it's going to still mechanically debride that dead stratum corneum layer off the top of the skin to increase cellular renewal and have all the benefits that mechanical exfoliation product has, but minus the dyes and the fragrance. So I'm working on it actually right now. My formulator is amazing, who's working with me, and we're kind of going back and forth, and I'm telling him exactly what I want in it. And, we're trying to work on that right now. So that should be coming hopefully down the pipeline soon. It's so fun to formulate and to engineer a skincare line. I know most dermatologists will white label or private label where they have a company who gives me, 10 SKUs and they put their name on it. But I wanted to engineer it myself. It's something that I wanted to do since I was a derm resident. And I'm like, I know exactly what needs to be in the skin product. I know exactly where it needs to go, how it needs to get there. And I don't want to wait for other companies to do this for me. I want to be able to do it and provide that for my patients and for my loved ones and for myself. Okay, let me just take a look real quick. Okay, I've used vitamin C before and my skin didn't take to it. So everybody's different. Some people can't handle vitamin A derivatives. Some people can't handle vitamin C. Some people can't handle growth factors or AHAs or BHAs. You just find what works right for you. And it's important to not get hung up on, say you have a friend or a sister who's using a product and like your skin doesn't like it, or your skin freaks out, or you don't get the results that she gets or he gets. It's important to just, do what works for you and not get hung up on, a certain product or active ingredient. There's no skincare routine that absolutely has to have a vitamin C, an AHA, growth factors, humectants, vitamin A derivatives, the scrub, triple cleanse, all that stuff. You just find what works out best for you and what your skin freaks out about and what it doesn't, what it tolerates, what gives a result. If you're using something and you don't see your skin change within 2 to 3 weeks, it's time to get rid of it. Or if you're using something and maybe you have some temporary purge that happens at the beginning, but then it resolves and your skin looks good, then that's fine too. But if it's not responding, or if it freaks out, or if you get itchy or rashy or allergic to it, then you don't have to incorporate that into your routine. So some people do have a sensitivity to vitamin C. That's okay. You either may want to test to see what vitamin C works for you, or just omit it from your skincare regimen altogether. What you can do is you can always test on the volar surface of your arm, which is this arm part of your arm right here, and test a product out, because if you're going to be allergic to it or sensitive to it, it would usually happen here just as well as it would on the face. So for my patients in clinic, when I see them, usually I just have them test it out here and see if it works right here, then it'll work on their face too. Okay, let's see. And then somebody said, Oh, doctor, what do you tell patients the difference between the drugstore skincare lines to medical grade? I have friends who think I'm crazy for spending so much on skincare. So there are some drugstore products that work pretty well, especially, there's some retinols out there. There's some, Differin is adapalene that used to be prescription strength only, and that's, in drugstores. You can buy it $12 on Amazon. However, I think that all people need to do is they really need to experience and use a real medical grade skincare product, use it for like 2 or 3 weeks, and then they have that aha moment. Because I see a lot of patients in my office too. They come into their clinic, they're buying their, different skincare products from Sephora or online from some online derm store or whatever. And then they get on, Zeo or Skin Better or Elastin or My Line, and they're like, oh my gosh, like, okay, now I get it. And honestly, you just have to experience it to use it and see what it does to your skin. I'm not big on like trying to push people one way or another, saying, see what it can do. I just say, just use it, experience it. And then I'm outcomes based and results based. I always have been as a physician. And once you experience it, there won't be any going back. And so I think let me go back to that question, wherever that was. There are some things that you can, use that are medical grade, but drugstore brand, but like not a vitamin C. I wouldn't. The vitamin C is such a highly unstable molecule. It needs to be very elegantly formulated, or else it's not doing anything. And even if a skincare product that you get Sephora is $20, it's a vitamin C and it's sitting on your skin and it's not even getting absorbed, or it's oxidizing before it even hits the skin, it's a waste of $20 even, so I think it's important to understand the difference. I may do a drugstore video so I could show you guys some things that are worth if you want to save money and get something from the drugstore and you don't want to invest in medical grade. But there's certain things like a vitamin C, anti-aging hydrators that have peptides and super potent anti-aging peptides and technology in it that you don't really want to exchange for a drugstore brand, because you're just not going to get the results. So it just depends on what you're willing to invest in, but usually you get what you pay for, and the results speak for themselves. And once you have fresh, healthy, beautiful skin without the need for makeup, there's really no going back. So it kind of just drives the your motivation to continue to use medical grade. Okay, so hi, Stephanie. Absolutely love all your content and learning so much from you. Hi, it's so nice to meet you guys too. Can't wait to try out your new skincare line. I'm excited for you guys to try it too. And again, I try 1 or 2 products, or don't even try mine. Try maybe one I recommend, or one if you have read about one that you like. Just try and see what works for you. My job is just to get you the best skin of your life, and just to get you on the right path to get you there. And doesn't have to be my products or another line that I even maybe promote. I just know what works, because I see hundreds of patients a week, day in and day out, and I see what they're reacting to. And I also look at skin under the microscope, so I see what these skincare products are doing. So I'm trying to just guide you to make the right decisions and get the right skincare product and regimen for you that's going to work and give you the healthiest skin that you've had. So I think that even if even though I do have my own line, I still think that you should rotate my line in with other lines, or rotate different products through, because I would say skincare is a lot like working out. Oh, it's giving me a pop-up here. Skincare is a lot like working out. You don't go to the gym and do the same routine every day. You have to keep your body guessing, and skin is an organ system, just like your musculoskeletal system is, and it responds to pulsing in different products and not getting stuck in a rut with your routine, if that makes sense. Okay, so I'll probably have to tie it up pretty soon here, but I think this was fun. I think maybe I'll do this every Sunday. I may not even post this video because it's so like low budget and like low grade and ratchet, but it was just more of like a test. But if anything, I got to meet you guys and talk to you, and it's just so fun to interact with you guys. Okay, let me just go through a few more though before I stop. What do you think about rose water glycerin spray for a nighttime moisturizer? That has broken out a lot of my patients. If you like it and it doesn't break you out, I say more power to you. Go ahead and use it. But it does that can cause a little bit of acne breakouts. It even breaks me out. But if you're using it and you feel like it hydrates your skin will tell you. If you're using a product, you're like, gosh, I still feel dry, or man, my skin's all itchy and I'm breaking out. That's the proof is in the formulation, and your skin will tell you 1 to 2 weeks after using it. So if you like it and you're using it, I think it's fine. I say go ahead and use it. Okay, maybe you can YouTube live on your phone. I tried to do it on my phone and it won't let me. I think what happens is, I had to log in and put a couple settings in and answer a few questions, sign these waivers and everything. And I think that because I've done it now on my ThinkPad, I'll probably be able to do it on my phone, which may be a little bit better. I'm like seriously like in my look, my like daughter put her like sweatshirt on here. I'm like literally like in my house in my bedroom and just like kind of wanted to test it out. And then we went live and I started getting questions and I just went with it. So it's fun to be spontaneous. But yeah, I'm gonna try to get this better for you guys. And I appreciate you guys being kind of like my first live experience, and patients that or followers that or subscribers that were able to like participate in this and help me learn how to do these lives, because I do think lives are very important. Because look, I'm your personal dermatologist. You don't even have to pay a consult fee. I'm just here giving you free derm advice because I know that you love it and I love it, and I could talk about derm all day long. And I finally found my family who loves derm as much as I do, and you guys can talk to me about skincare all day, which is my favorite thing. Okay, let me just scroll down a little bit. Okay, so let me see. I just got a facelift in 2 weeks post-op, and I'm 2 weeks post-op. Congratulations. What should I do to keep it looking good besides my skincare routine? Well, I think skincare is a really important component of the longevity of post-facelift. You have to remember, the more collagen and elastin and healthier, renewed cells you have in your skin and your epidermis, the longer that your facelift results are going to last. I see patients sometimes who have done nothing really to stimulate collagen, or they don't usually use good products, and they'll go in for a neck lift, and they kind of don't really care about their skin for their first 50 years of life. They have a neck lift, and then a year later it's back where it started. So surgeons always say it's like suturing wet toilet paper versus suturing cardboard. If you have a lot of collagen in your skin, those surgical results are going to last. If you don't have collagen and high quality skin, your skin's just going to fall and be right back where it was. Maybe not back to your baseline, but gravity will always unfortunately win unless your skin is strong and has a lot of the extracellular matrix proteins, the collagen, the elastin, the hyaluronic acid, the cellular renewal process, which keeps the cells young and vibrant and healthy. Without that, your results won't last. So I would say use good medical grade skincare. I would say maybe try doing a laser or an energy-based device every couple years just to keep the collagen stimulation process going, and then wear sunscreen. So I think that those are probably my 3 biggest recommendations for you. And congratulations. I'm sure that you're loving your results. Let's see here. Thank you so much for all the amazing information. You look amazing and have so much knowledge. My favorite skincare channel. Oh, thanks. I feel ratchet right now, but thank you for saying that. And I love doing this for you guys. Are you going to make a face cleanser like Skin Better Oxygen Infusion Watch? You said you really like that. I really do like the oxygen infusion. I have acne and melasma though, so that the AHAs help with my melasma and the oxygen helps with my maskne and acne. So I like that one, and I am formulating a cleanser as we speak now too. So that should be coming down the pipeline as well. So all of these things to look forward to, and it's super exciting. It's so fun to do it. What are the benefits of Clear and Brilliant? So for those of you who don't know, Clear and Brilliant is a very light resurfacing laser. So the benefits are it improves texture and tone, it evens out pigmentation, it stimulates collagen and elastin, which helps with fine lines and wrinkles, and more importantly, it shrinks the pore size. So remember, if you look at the follicular ostia, which is the pore, like if you're looking at a pore head on, there's a collarette of collagen and elastin around the pore, and the Clear and Brilliant shrinks it up. So it shrinks down pore size, which is really an amazing phenomenon that it creates. So shrinking pores, helping the skin look smooth and tight, and even in the pigmentation, and even if there's little wrinkles or acne scars, pitted acne scars, things like that, it really helps. And the thing is that it's a lighter, more superficial laser. So unlike a Fraxel, you need about 3 or 4 Clear and Brilliant to equal the results of 1 Fraxel. So it's a lighter laser, but the benefit of it is you don't feel any pain. There's no downtime. You walk out of there, you can go along with your daily life and go meet your girlfriends for lunch afterwards, and nobody's going to know you had a laser treatment. Fraxel, it's not painful, but it's not painless. So it's a little spicy. People say 3 or 4 out of 10 on the pain scale, and you're a little bit red and sunburn looking for about a week afterward. You're not like bloody and doing vinegar soaks as you would be like a CO2 Fraxel, but the Fraxel Restore, you're a little bit red and you look like you got like a sunburn or something for about a week afterwards. Whereas Clear and Brilliant, you don't have any downtime, and it really glows up the skin a lot. So I do it like every 3 months on myself. So it's one of my favorite things to do. Okay, let me see. Okay, what would you recommend for a good lip moisturizer? Honestly, just good old Aquaphor. There's a lot of like fancy lip masks, and Skinmedica has an HA5 lip mask, and that Lang lip mask is really good. But honestly, just using Aquaphor, I think just putting it on before bed, you're gonna have 6 to 8 hours hopefully of uninterrupted sleep, and that the Aquaphor and the humectants and the humectant capability of it is gonna have about 6 to 8 hours to work without you wiping it off or eating or drinking and wiping it off. So I think that that's one of the best things that you can do for lip therapy. But there's a lot of great lip hydrators out there, but they can be pretty pricey. And honestly, just dermatologist Dr. Kennedy and I, my colleague who I work with, we just do Aquaphor on our lips. But if we were feeling fancy, we could do like a Skinmedica HA5 lip treatment, or lip drink, or one of the ones that are a little bit more expensive. But honestly, save your money, because there's the Aquaphor is just fine, I promise. Okay, well, let me see. Hi, Stephanie. Hi. You guys are so sweet. It's so great I could talk to you forever. Oh my God, I want to do this every day. Okay, can retinoids be used while breastfeeding? Okay, no. I'm so glad you asked me that. So no. Breastfeeding and pregnancy, no matter what you say on the internet or online, or any vloggers or whatever, retinoids can't be used during pregnancy. There's just no data proving their effects on the fetus or a new baby. And especially with breastfeeding, we're not really sure how much systemic absorption gets in and excreted in the breast milk. So whenever we don't know, and it would be completely unethical to do that study. I mean, can you imagine? So we just, all dermatologists and OBGYN say no vitamin A derivatives during pregnancy and breastfeeding. Even pumping and dumping, I just don't think it's worth it. And I know that I've had 2 or 3 people ask me recently if Retin-Aldehyde is safe for pregnancy, and the answer is no. You have to remember that sometimes people giving like medical advice are non-physicians. They have no accountability. They're not going to lose a medical license if they guide you the wrong way. But we care, and patient health and safety is our utmost priority, more than selling a product or whatever. So do no harm. Patient safety and health is most important, and it's absolutely not okay, I'm sorry, to use a Retin-A or a vitamin A derivative, including Retin-Aldehyde. So anyone who tells you differently probably has an ulterior motive or agenda and wants to sell. And we have to think of you guys first, and your health and the health of the baby. So sorry to give you that answer, no. But you can use a lot of other things. You can use vitamin C. You can use different products and humectants to make your skin look its best during pregnancy. And also during pregnancy, melasma and acne can kind of creep on in there with the hormone fluctuations. But antioxidants and polypeptides are really a great way to kind of keep that at bay, and are also really healthy for the skin, and something that your skin needs, as your body needs extra nourishment during that time. So sorry to give you that bad news, but I'm glad that you asked me, because if you had that question, I'm sure other people would too. Please do live regularly. I totally will. This is so fun. I would love to do this with you guys every day. I love you guys back. Okay, I'm using your eye cream, and it's amazing. My eyes have never looked better. That is what I want to hear. That makes me so happy. And that's what I've been hearing too. As a matter of fact, some people who couldn't get in to see me for a laser resurfacing and Fraxel under the eyes, I started them on my eye serum, and then they canceled their appointment for the laser resurfacing because they said that the eye serum worked so well. So that means everything to me. That's why I formulated this for you guys. I know it needs to be in there, and I'm so happy that you guys are enjoying these products. And to be honest, although I do switch up my routine, I've been using my products that I've engineered for almost 2 years now, and I'm obsessed. I can't even break without them. One time they lost my luggage in the airport when we were going on vacation, and I literally was in a panic asking my formulator if he could ship me my products, because I'm so dependent on them. But I'm glad that you guys are liking them too. Okay, what preventive anti-aging procedures do you recommend for someone in their late 20s? You're still such a baby in your 20s, so I'm so glad that you're even aware of proactive skin health and skin taking care of your skin long term, because in your 20s it is important. So wearing good sunscreen honestly is the number one thing, and using some medical grade. You don't have to invest a lot into medical grade. If you could get on some vitamin A derivative, or some type of retinol, or even if you're using tretinoin just once a week, a little goes a long way in your 20s. But honestly, photo protection and sun protection is everything. So that would be my number one, because usually in your 20s you don't usually care. I mean, I cared when I was in my teens still, but most people in their 20s don't really care, and they get a lot of sun damage that in their 40s and 50s can really accelerate the aging process. So it really pays off. Always wear sunscreen, rain or shine, and on your neck, your chest, your face, your back backs of your hands. It's really important. And because I wanted to go into dermatology, I had early exposure to the importance of, wearing sunscreen and protecting yourself. But usually most, 25-year-olds are not going to be putting sunscreen on their chest and neck, but they're also going to be accruing sun and UV damage that when they're in their 30s and 40s is going to make their skin saggy, and then they're going to start to care. So I would say I congratulate you on starting early, and just sun protection and some use of some medical grade or, some active ingredients in your skincare, especially like a vitamin A derivative, which would be great. And then also an eye serum too. It doesn't have to be an expensive eye serum. Even if you're putting Aquaphor around your eyes in your 20s, that's better than not doing anything at all. So I think that's would be my advice. Okay, what do you think about microneedling? What are the caveats? Okay. So this comes up a lot. Microneedling, I'm not a big fan of. I also don't want to ever say anything negative about a company, a procedure, a device. But the thing with microneedling is I've been doing microneedling a long time. Even back in the day when it was first launched, I did like a Good Day LA segment on microneedling and PRP and the vampire facial, all that stuff. The thing with microneedling is there's a temporary swelling that looks good for about 1 to 2 weeks. But then once that swelling goes away, you're usually back to where you started from. So it's a lot of pain, it's money, it's downtime. And your baseline isn't that different than what you look months later. And once that improvement fades away because the swelling goes away, there's no real longevity to that treatment. And also, as a provider, I get referred patients who have had microneedling at other offices. They come to me with like post-inflammatory hyperpigmentation, scarring, pitted acne scarring, infection. I mean, it's just like a nightmare. So I try not to say anything bad about it, but at the same time, I take a Hippocratic oath as a doctor, do no harm, and provide information to protect people from having bad things happen to them. So not until microneedling gets a little bit more elegant, I can't really recommend it. I mean, if you do a laser on someone and you look at a skin biopsy or their skin clinically, like 6 months later, 1 year later, they still look good and they hold on to those benefits. So microneedling can't really touch the elegance or the performance of laser, in my opinion, at this current time. And they can kind of increase the technology of microneedling, even with or without RF. I know they have RF available now, but I've also seen patients with horrific scarring from microneedling RF. So, you're a product of your experiences, and I've just seen too many complications and bad outcomes and unhappy patients from other providers providing microneedling that I can't really recommend it. So, and I hate being negative because I'm not a negative person, but I do have this obligation to, guide you guys and provide truthful and honest information for you. Okay, so oh gosh, there's so many more questions. I'm sad because I feel like we've been on here a long time and I don't want you guys to get bored, but I could answer these questions all day. Okay, what is the best treatments for under the eyes? I'm 52 and battling wrinkles and dark circles. Okay, so dark circles can be treated with V-beam. It could be treated with, it depends on if it's pigment or a vascular reason for why you're dark under the eyes. Sometimes there's a vasculature under the eyes that gives like a bluish kind of purplish discoloration. V-beam laser does a great job of erasing that. As far as pigmentation from like melanin or pigment in the skin, usually like a Clear and Brilliant or a Fraxel can help relieve the pigment. So can certain eye serums. And my MD Air eye serum definitely has agents in it that are safe and sensitive for that delicate and orbital skin, but can help lighten under eye dark circles and puffiness. Also stimulates collagen and elastin. And then also treatments for under the eyes for like crepey skin and wrinkles. I really love doing Fraxel and laser resurfacing for under the eyes, and also an energy-based device called Thermage. So you want to increase the collagen and elastin in that delicate, thin under eye skin, because that's the first to lose collagen and elastin. That's the first area of our face to show our age. That skin needs to be babied. So eye serums are really important, and also doing laser resurfacing and treatments to kind of stimulate collagen and elastin in that area. Okay, Carolyn, one of your patients. Hi. Oh my gosh, I love seeing my patients on here. Okay, I want to say hi. You look great. Oh, thank you. I'm like all pixely and probably granulated on this horrible resolution camera, but thank you so much. I appreciate it. It's so good to see you guys on here. How often should you exfoliate if you have combination skin, and what can you use to exfoliate? So exfoliation, different dermatologists even will say different opinions on exfoliation. I like the Zeo exfoliating polish. I do it once a day in the morning. Morning is usually more important to exfoliate than in the evening, although you would think evening because dirt, oil, makeup, debris, sweat, sunscreen that gets layered on, you want to exfoliate that off. But more importantly, during sleep, while you're sleeping, your skin releases sebum, your cells rapidly divide and they renew themselves. So you kind of have this dead layer of skin cells and sebum and debris on your face in the morning that needs to be exfoliated off. You can do it at night. I would just say pick one or the other, do it once a day, and morning's preferable over evening, but it's great to do it once a day. And you shouldn't be using an exfoliant, mechanical or chemical, that's too abrasive or harsh, because then you wouldn't be able to do it every day. And if you are using one that's a little bit more aggressive, I say do it maybe once a week. But if you guys haven't tried the Zio Skin Health Getting Skin Ready, it's a cleanser, exfoliating polish, and pads. I posted it on my YouTube channel, my morning and evening skincare routines. It's up there. I post on Instagram all the time. And again, I have no ties to Zio as a company at all. I just think that it works really well. And I see patients using it in the clinic, in the office. I see hundreds of patients a week and see what it does for their skin. So I want to recommend the best. But if you guys have an exfoliant that you like, or that you use, or that a friend uses that you think is good, I'm always more power to you. Use whatever works for you. But I really love the Zio exfoliating polish, and I do that every morning for myself. So that would be my recommendation. Okay, do lasers stimulate collagen after age 70, or does something else work better? So that's a great question. So each decade of life, it gets harder to stimulate collagen. But yes, absolutely. You should see some of my 70-year-old patients in my clinic like rocking it. As a matter of fact, my patients always look about 20 years younger than they are, and like they've had nothing done. So that's my kind of claim to fame. Keep them looking natural. Just look 20 years younger than you are, but like nothing has been done. And that's my goal. So in my 70-year-old patients, they get laser resurfacing. They get it maybe once a year. And these are people who just started in their 70s. As people who've been taking care of their skin maybe since their 50s or 60s, but they're not new to it. So it's easier to induce collagen stimulation in skin that has been conditioned to do so. Similar, like I said before, I made the analogy to the musculoskeletal system to the skin. Your body, like if you see a woman walking around the gym who's in her 50s or 60s and her arms are all ripped and she's super fit, she didn't just start working out. She's been working out her whole life, or for at least 20 years. So your skin's the same way. People who start earlier will have longevity, and they'll be more responsive to treatments or active ingredients than people who have not been taking care of their skin. So yeah, at 70 years old, we absolutely can stimulate collagen. And you should see some of my 70-year-old hotties that come in my office. I'm like so proud of them. And I always ask them, what did you do before me? What have you been doing, for the last 10 years to look so good at, age 75 or 72 or, whatever age they are. And it's usually laser resurfacing and using, medical grade skincare, or just using like a Retin-A, because back in the day, skincare wasn't as innovative as it is now. We didn't know as much about the skin and all the anti-aging pathways in the skin as we know now. So hopefully that answers your question. Okay. Oh my gosh, so glad you're live. What can I say? What can I do for Jowls? I live in Costa Mesa, by the way. Oh, you're close. You're like right next to me. Okay, I want to come in and see you, but what can I do in the meantime? I'm a single mom. What's the most affordable? So Jowls are these guys right here. There's so many different things we can do for the Jowls, and it just depends on what goal you're looking for. And this is how I consult and talk my patients through a procedure and treatment plan too. So it all depends on what you're looking for, how invasive you want to be. Even doing a little bit of Botox along the jawline for Nefertiti lift will help with the Jowls. Doing a little filler in the pre-jowl sulcus or back here to kind of pull up. It depends on your age too. I think you said, I don't know if you told me your age in that post, but we lose, our bone starts to disintegrate. It's kind of a bummer, but we can do things to fix it. But our skin thins and our bone resorbs over time. And so when you lose that structural support of the jaw, your skin doesn't have that platform and underlying stability to pull it up anymore. So sometimes doing filler to restore that volume loss here will help keep the skin taut and smooth and lift up on the Jowls. Then there's Thermage, which is one of my favorite energy-based devices. It helps lift and tighten without surgery. There's thread lifts we can do. There's lots of different things that we can do. So girl, I got you. So if you come into my office, I'd be happy to see you. Or if you need a referral to someone who's closer to you, but you're in Costa Mesa, I'd be happy to walk you through it. But there's lots of different things that we can do that are non-surgical, that last long, that are minimally invasive, not scary, keep you looking natural with amazing outcomes. Okay, let me see here what's going on. I think I missed a few. Hi, Dr. Capel. What is the best way to combat dry skin? I've been using Dr. Baji's advice that moisturizers can be counteractive to the skin, but Cosmetic HA5 is expensive. So yeah, so for your body skin, you can use moisturizers, hydrators, oils, even if you want on your body skin. Skin on your face is different. You want to avoid oils. Oils can clog your pores, cause your pores to get stretched out, cause blackheads, acne. It increases, collagen breakdown. It does. The oils are like Dr. Obaji used to say. I actually was at his house just the other weekend. I told him I was launching my own skin line and wanted to thank him for everything that he's taught us about skincare and our view of skin health. But he would say sebum and oil is toxic to the skin, and he is right, which is very counterintuitive because you think that like oils and moisturizers are hydrating to the skin, but your skin needs water to hold on to, not oil. When you're at the gym and you're working out, you don't grab your Hydro Flask full of oil, you grab it full of water. Your skin's and your keratinocytes, your skin cells need water to hydrate. So they need active ingredients that stimulate their ability to retain water and that reinforce the barrier to minimize transepidermal water loss. So I would say for your face, if you wanted to go, if you wanted to go medical grade, I mean, HA5 by Schematica is expensive. I have my NMF hydrator, which is packed full of anti-aging peptides and humectants and natural moisturization factors that hydrate the skin. Trio by Skin Better Science is great. But also if you just want to get like drugstore brands, Hydro Boost by Neutrogena is not a bad thing either. So I think that it just depends on what your price point is. You don't have to spend a ton of money, but just find one that's non-comedogenic and does not include oil and that stimulates your body to hold on to water. So I hope that this helps. Okay, well, TCA peels help tighten loose neck skin. So happy you're alive. I know I'm happy too. I've been like on here for I don't even know how long, but I'll probably wrap it up soon because I know that people probably have to go, but it's so fun. I've been on here for 43 minutes. Oh my gosh. Okay, we'll wrap it up soon, but this is really fun. I could do this all night. Okay, well, TCA peels tighten loose neck skin. So happy you're live. Hope you can get most of the questions. Yeah, so I'll try to not belabor my answers and go off on tangents like I do. So tightening loose neck skin, there's lots of different things we could do non-surgical. Thermage is an energy-based device that helps tighten and lift the skin without surgery. Fraxel can help tighten loose crepey skin. Hyperdilute Radius, which is a stimulant filler we can do in the neck to help with that loose crepey skin. For people who have a lot of laxity and probably should have surgery but don't want to undergo surgery, and rightfully so, I totally get it. I'm the same way. PDO threads, when they're done the right way and by a skilled provider who knows their anatomy, preferably a surgeon like myself, that knocks it out of the park. I did a couple last week, and these neck lift patients with PDO threads were like, it made my jaw drop. I was like, damn, it can do a lot, and it's minimally invasive, no incision, no scar tissue. It lasts about 2 to 3 years, and then you have it done again, and it's a perfect example and a perfect way to not have to avoid surgery and to tighten up that loose, crepey skin on the neck. Okay, what do you think of hydrofacials? I'm going to try to go fast through my questions. I love them. I think they're great. You do what you can. I mean, it can get pricey if you're doing it every month. Some of my patients who are more like OCD and really on their skincare game get it done every 1 to 3 months, but hydrofacials are like a medical grade infusion and purification facial for the skin. And it does have a lot of skin benefits, 1,000%. Okay, I hope your skincare will be available to order from Canada. I hope so too. I didn't know it wasn't. Actually, I need to look into that because I think we were able to ship it to Canada. So you may want to check again. During the launch, we kind of had to limit it, but I think now it should be available. I have my team meeting tomorrow with my fulfillment center. So I'll bring this up to them as well. I'd like to book an appointment in the future to get some procedures done by you. I'd be happy to see you. I love meeting you guys in person in my office. It's so much fun for me. Okay, what is the best thing for lip lines? I'm gonna try to go faster. What is the best thing for lip lines and tightening skin on the bum? Okay, so for lip lines, I really like either laser resurfacing to help erase those etched in lines. And then for tightening the skin on the booty, if that's what you mean, I have an M-Sculpt device, which I don't know if you follow me on Instagram, but I've used and has really given me some gains, but also laser surfacing and thermage of the booty skin, and then doing M-Sculpt, which helps build the muscle under the booty, which helps, adds volume, always makes the skin contour on top look great. Sculptor is a stimulant filler that's really great for booty skin as well, if that's what you're referring to. But there's lots of different things we can do. And the cool thing is that there's options. So it depends on, do you want an injectable? Do you want a laser? Do you want an energy-based device? What kind of procedure are you interested in? And sometimes we do combination different treatments. I always do one treatment at a time, see how you respond. If you love it and you're happy, we stay there. If you're like, okay, I want a little bit more, then we go at it with a different modality. And it's always like 1 + 1 = 3. And so there's lots of different things we could do, and there's different options. And I know what works because I've used them all. Let me take a look. I think something just popped up. Okay. Oh gosh, typo something. Oh shoot, I think I missed that one. Okay, what fillers would help with indentations on the forehead? So if you're talking about sleep creases right here, usually that's Vobella or a more superficial, lighter, lower G prime filler. But I would have to see you in the office to tell, but usually that's Vobella. You have to be careful with filler in the forehead because it can be tricky. It can migrate, it can fall, and you have to go to someone who's an expert like myself to be able to be in safe hands and to even see if you're a candidate for it. Have to use a cannula, has to be done safely and effectively, but I would probably use Vobella, but I'd have to see you first. Okay, let me just see if I could just scroll through some of these. Okay, let me see. Can I use Retin-A on top of Alto Defense? You always want to use your Alto first because remember vitamin C has, Alto is vitamin C by Skin Better Science. That always has to go first, and anything that comes on top of it has to be, about a minute or two later. You never want to put on something before vitamin C because vitamin C is a very finicky molecule and needs a very specific environment and cellular milieu to have the perfect, pH and lipid profile for it to become active and stay active and be transported through the epidermis into the dermis as well. So just be careful with that. I put the Retin-A on after your vitamin C, and I'd let the vitamin C sit on your skin for a couple minutes, or probably like a minute or two. If it's my vitamin C, you'll see it gets sucked in and it just gets delivered really fast. Okay, Stephanie Capel will see a video of you in 2022 supplement list. Yeah, so I did a supplement list. Yeah, that was actually 2021, I think. I did a hair supplement list this year, but let me do another supplement list for you because I get questions about that all the time, skin supplements. And because there are certain supplements that are definitely beneficial for the skin, and we know that. And I want to share that information with you. Okay, let me just see. I'm going to try to get to all of you guys. Hold on, I'm almost caught up. Okay, I want to get to all of your questions. I have atopic dermatitis, that's also known as eczema, on my right temple that won't clear up. It makes it hard to use products other than CeraVe. So that skin, needs a lot of added hydration. And if it's above on your right temple, it may be seborrheic dermatitis or eczema, atopic dermatitis. I would just make sure that you're using, something very hydrating on that area. Put that on first, and then just don't put your actives on that area because that skin's broken down. Atopic dermatitis has a filaggrin gene mutation and a little barrier breakdown. So your barrier isn't intact enough to handle the active ingredients. However, if you put something, I wouldn't say like Aquaphor, but Aquaphor or an emollient or something very hydrating over that skin, and then put your active ingredients around that skin, it should help it because the hydration or the barrier that you put on top of the broken down skin should serve as like a physiological barrier to protect active ingredients from crossing the broken barrier of your skin. So hopefully that makes sense. But I would just avoid that area until it's healed and you're not having we call it the itch that rashes, because atopic dermatitis is a vicious itching rashing cycle. Okay, let me see, I can't get through all these. I'm sorry. Okay, let me see. Oh, good morning, Dr. K from Portugal. That's my doctor. Oh my gosh, it's so good to see you. Hi, Edward. Oh my God, you're in Portugal. I love it. It's good to see you. I hope I see you in clinic when you get back. Thanks for the HelioCare samples. I've been on it since my consultation. Dark spot is practically gone. See you guys in April. Oh, I'm so glad to hear, and I'll see you soon. Let me see. I still have product from my consultation. Want to try your line? Do you ship to Portugal, or should I wait until I get back home? I don't know if we ship to Portugal yet, but I will have a whole packet waiting for you when you come back to Orange County. And I wish you the best. And it's great to see you on here. What could a little bump on top of the ear be? What kind of off topic, but derm appointment in my areas is so long to wait for. Our dermatologists take a long time to get in to see because we're few and far between. There's not very many of us. Just thought I would ask your thoughts on my son just felt like it was the other day. Okay, so if there's a bump on top of the ear, there's something called dermatosis nodularis helicis. It could be a keloid. It could be a little accessory tragus. There's lots of different things on the ear that it could be, but I would follow up with your provider. If it is growing with rapid growth, and I'm not supposed to give medical advice over Instagram or YouTube or social media. So this is disclaimer, follow up with your provider and your physician. This is not medical advice. However, if it's growing at a rapid rate and it's getting bigger, over this past few weeks, or it's painful, or if it's bleeding, get seen right away. Like push yourself in to see, someone and have a biopsy. So that's not something that you want to wait on. However, if it's something that has been present since birth or for many years, just kind of getting annoying or cosmetically bothersome, then I would just, wait until you see your dermatologist. But there's a lot of little benign growths that can happen on the ear that are not too worrisome. But of course, without seeing you as a patient, I have no medical advice to give you, but that's just my over YouTube, not being able to see it in person advice. Let's take a look. Okay. Hello. Hi guys. Is it worth buying Hydra Tox for lines? I say just use it. I mean, it's new. The data is not like overwhelmingly impressive, but I say it can't hurt you. I say try it and let me know what you think. My colleagues, some like it, some don't. It's hard to tell. So I would just say it can't hurt you, and if it's a good thing, then we got to propagate, accurate, sound information. And so I'd be happy to see if you like it too. I haven't been too impressed with the data though, so I don't advocate for it for my patients, but I don't want to say anything negative about it either. So I think it would be interesting to see what you think. Okay, threadless pros and cons. Okay, threadless, when done correctly, slam dunk, super easy, amazing results, happy patients, don't have to undergo surgery. Cons, some estheticians are allowed to do this in some states, and without a medical background, without even being an MD or a surgeon or someone who knows their anatomy or dermal planes, they can have horrible side effects, puckering, divots, deleterious outcomes. However, those outcomes are reversible. So I would just say go to somebody who knows what they're doing, who is well-versed, experienced, preferably a plastic surgeon or dermatologic surgeon, because we know we can do this like the back. We know the skin planes, dermal planes like the back of our hands. But for somebody who doesn't know what they're going or doesn't respect anatomy because they don't know the anatomy or what lies beneath, it could be catastrophic outcomes and horrible side effects. So go to someone who knows what they're doing. Your results will be amazing. And I can't say enough great things about PDO threads, but if you're going to somebody who is going to be at risk for a suboptimal outcome or a complication, then, don't do it. So those are the cons. Okay, thank you so much and can't wait to use your products. Me too. I can't wait for you guys to try them. What are your thoughts on Dysport versus Botox? Both are neuromodulators. I say, if people have been doing Botox for a while and they start to feel like they're not as sensitive to it anymore, Dysport's a great option. I think they both kick in at the same time. They both usually have the same duration. One may have a less side effects with respect to like headaches, or, some people say that, Botox can cause a headache or, a migraine. Usually I recommend Xeomin over Dysport in that case, but it all has to do with the proteins that the botulinum toxin is reconstituted with. But for all intents and purposes, Botox is usually the tried and true, the best. Every other neuromodulator tries to go up against them, and in their studies at best will say they're as good as Botox. But I do have some people who like Dysport, and because they like it, I carry it in my office, and I'm happy to give them whatever they think that, whatever makes them happy, whatever works for them. But I do, between the two, I don't really think that there's one huge advantage of one over the other. I actually like Botox better. Okay, Dr. Capel, what are your top 3 in-office anti-aging therapies? Oh gosh, okay, putting me on the spot. I would say Fraxel, resurfacing, Thermage, and Threadless. I think those are the 3 most like pack a punch, give me an outcome, give me my results, and I'll be on my way. So those are my 3 if I had to pick my top 3. Okay, I'm in Pennsylvania. I wish I could travel to see you, but this is the next best thing. Yeah, see, that's why I did these lives too. I want to be able to, like, people who don't live in Orange County or Newport or Laguna and can't come to see me. This is my way of interacting with you guys and being here for you. Let me see. I've learned a lot from this live. I'm so glad that you learned a lot because I love sharing information. I just wish I had a bigger platform, but I think YouTube and Instagram are my ways to just kind of interact with you guys and be here to answer your questions. Okay, want to buy your products? Where do I go and do that? You're so sweet. So my website is mdaire.com or mdairskincare.com. You can go on there, just read about it. I wrote all the content myself. There's a super nerdy scientific page with like flashcards and molecules and signal transduction pathways and all my nerdiness. You can just skip right over it if you don't like science. If you love science and you're curious, you want to see it, I wrote it all there for you. So just take a look and you can visit the website. Let me see. I was wondering if you have any thoughts on M-Appeal MEP technology. I have to look that up because I actually don't even know what that is. So let me get back to you. Let me take a picture of it. I'm going to take a screen grab and I'm going to look that up for you and get back to you. Okay, Dr. Kaplan, I'm curious, how many hours of sleep do you get? You look great. Okay, I have 2 kids and I'm running 2 businesses and I have a medical practice, so not that much sleep. But I try to get, in all seriousness, I do try to get about at least 6 hours of sleep a night. I wish I could get like 9, but then I would never be able to work out or, take my kids to school or do their activities with them and kind of, see my patients and just, be on social media. So I usually get about 6 hours of sleep. But in medical school, I'm talking about all throughout my 20s and the better part of my 30s, even in my residency and fellowship, I would get like probably 3 hours of sleep, which I actually feel guilty about because I thrashed my body just by living a life of just, in the grind, like seeing patients, studying, doing research, publishing research papers, studying for exams, taking boards, more hospital time, 80 hours a week. And then I had babies when I was still in school. So I really have not needed a lot of sleep my entire life, like literally for probably like almost 2 decades, I got like 3 hours of sleep. But right now I try to make myself go to bed. I drink my chamomile tea with my collagen peptides and try to wind down after putting my little ones to bed. So I get about 6 hours of sleep, but I appreciate that. And thank you so much for saying that, because I feel like I'm run down half the time, and it's all about balance. It's all about, I do all my social media. You'll be able to tell, because you can tell it's my voice. If I handed it over to somebody, it wouldn't be coming from me, and it wouldn't be from me to you and us having this interaction and engagement together. So I do all my social media. I see my patients in my office. And again, my 2 little ones are my everything. I try to be the best mom I could be to them. And I work while they're at school. I get them ready in the morning. I take them to school. I work about 6 to 7 hours straight, and then I pick them up from school and do all their activities with them. So they don't even know that I work. And I wanted it to be that way. I didn't want them to be raised by, someone filling in for me. I wanted to be there and be present. So thank you for that. So a little information about myself. Okay. So last question. Thank you. Somebody's thanking me for the informative videos. I love to do it. I'll have more. If you guys like these lives, put it into comments on my other videos so I can see it. And maybe I'll do a live every Sunday. That could be our date night. So just let me know what time works best for you guys, because I know that some of you guys are out of international too. All right. Thank you so much. Always great info. Have a great evening. You guys too. Okay, last one. So type A and OCD, I have to get to all these questions. It's like an exam, and my test taking OCDness comes into play. What are your thoughts on lash serum making eyes hollow? Yeah, so that's the data. That's what we're hearing now. It's hard to say. It's really hard to say. And honestly, I will answer that question when I have more data available, because I'm hearing this, and I'm actually having patients coming into my office saying that they have infraorbital hollows and they have darkness from lash serums. Let me get back to you on that when I know a little bit more, if it's the prostaglandins or what the active ingredients in the lash serums are that are making the lashes get the infraorbital hollows being worse. Because the data, looking at our scientific medical literature, which aren't, when you Google papers and stuff, those aren't the papers that the physicians read. We read our medical peer review literature, which isn't available to, unfortunately, the public. And you have to pay to be a member of societies to get access to these studies. But I need to look at my research. That's where I get all my medical information. So when people will say, I saw the study on Google, it's usually those are paid in marketing and not real studies. But let me look into the real studies and get back to you guys on that information. I have to do that as well for my due diligence, because I've had patients coming in asking me if the lash serums have caused a little under eye hollowing, because they've reported it anecdotally too. All right, you guys, I love you so much. Thank you so much for doing this. This is our first live. I think that's so fun. Okay, I'm gonna try to do this every Sunday. Again, when somebody does a live, you can't memorize and regurgitate information. I think it really sets apart people from, who know their stuff and can answer questions on the fly. Dr. Kennedy, my colleague, and I are in the office all day together, and I'm like, she should do an IG live and YouTube live, because this is how you know that we're not like, okay, let me get back to you on that. Let me just look it up and read something online and regurgitate that back to you. I really am about providing truth and honesty, honest answers to your questions, and I will never lead you the wrong way, because my utmost important goal is to have you have the best skin, the healthiest skin, and not to spend money on treatments and procedures that are going to waste your money or hurt you or harm you or not work. So that's my goal. I love you guys. Thank you so much for being my YouTube family. I feel like this is a really fun start to a really bright future together. So, all right, good to see you guys. I may not post this. So if you don't see it on my YouTube channel, it's so like ratchet and like not professional that I may not post it. But if I decide to, don't laugh at me, because I know this is like non-professional, but I wanted to just test it. So I think our very first test went well. All right, love you guys. Have a good night.